Spider veins are treated primarily for cosmetic reasons. They are not of significant medical risk. They are, however, unsightly, and a lot of people treat them just to, be able to wear shorts or bathing suits or feel comfortable showing their legs in public. They do occasionally itch or burn or sting, which is usually alleviated by treatment. There are 3 options for treating spider veins. The gold standard for spider vein treatment is sclerotherapy. Sclerotherapy is injecting a solution inside of the vein, which then irritates or destroys the lining of the vein, makes the vein collapse, and your body absorbs it over a few weeks. Another option is laser treatment. Laser treatment doesn't work as well on the legs as sclerotherapy. It also hurts more and is not quite as efficient. There's a third option for using a technique called ohmic thermolysis, but that's only good for veins that are less than 1 millimeter in diameter. Most of the time we do sclerotherapy for spider vein treatments. We call a treatment a half an hour, and we treat as many veins as we can during that half hour. If the patient directs us to a particular cluster of veins, we will work on that. Otherwise, our general approach is to treat the biggest and the most obvious veins. Most people need 2 or 3 sessions, if not more, to get rid of most of the veins. Sclerotherapy will never get rid of every single vein. My goal is usually 80%, and so that someone can stand in front of a mirror looking at shoes or shorts and not say, "Oh, I hate those things." After a sclerotherapy treatment, the veins look worse for 3 or 4 or 5 days. There's the small bruises, and they're discolored and dark. And after about 3 weeks, they start to fade away, and usually at 4 or 5 weeks, you can notice a significant difference. That's why we do the sclerotherapy treatments no closer than 4 weeks apart, so that there's adequate time for us to see what's cleared and what still needs to be treated. We do a lot of spider vein treatment here in the office. Again, we do sclerotherapy most of the time. I have 2 nurses that assist me in doing spider vein treatment. One has been doing it since 2003 and one since 2005. I would guess that each of them individually has treated more spider veins than anyone in town other than myself. Well, our primary interest is in taking care of the patients, whether they end up needing treatment or not. So we try to treat each individual as a person, respect their time. I don't overbook my office. Patients rarely wait more than 5 minutes in the waiting room before being brought back to see me. The staff will individually greet you. I will see every patient for their initial consultation. We try to make it comfortable and easy and not waste your time. So the appointment may take a while, but you should never be sitting in our waiting room for very long.